Welcome everyone back to another episode of Health Corner. Have you ever heard that oral health is the window to our overall health? This is something I had heard many years ago. There's a lot of studies that are being linked to bad oral health and severe illnesses from cancer to heart disease, even Alzheimer's. That's why today we are joined by Dr. Mark Stein, a leading dental and maxillofacial surgeon, to discuss the matter and regain our oral health. Welcome, Dr. Stein.
Thanks so much for having me.
There's so many things I want to cover today, just because I know you also have done some things around sleep apnea, and I have a lot of issues in grinding, teeth grindings. But before we get into all that, let's dive into the part around these terrifying studies that are out now showing these link between oral health issues and severe diseases. Can you elaborate or explain?
Sure, that's a great question. And in recent times, more and more studies have come out that have a direct link between poor oral health and increase in either heart disease, high blood pressure, low birth weight, Alzheimer's disease, weight gain. Basically, what all the studies are showing is that if you don't take care of your teeth and gums, you start to build up bacteria in your mouth. These bacteria can either travel from your mouth to other parts of the body and affect, for example, your heart valves, or these bacteria have certain proteins on them that, when metabolized, increase your amount of inflammation. Regarding Alzheimer's, some of these proteins have been now found in brains, post-mortem brains of patients with Alzheimer's. 4 out of 10 patients with Alzheimer's have these proteins in their brain that can be directly linked to oral bacteria. So what more and more studies are showing us is the more you take care of your oral health, the better your overall health is going to be, which people have been saying for years, brush your teeth, take care of your gums. But now we see that there's a reason for that. There's actually direct clinical data that shows that there's a direct correlation between oral health and general body.
Wow, yeah, that's scary. I want to make sure I brush more often. So this is
brush your teeth every day.
I need to floss. We were talking earlier. I really need to floss, but I know dental work can be dreading for a lot of people. I think the thought of going to a dentist doesn't excite everyone. Things like implants, for example, they're typically lengthy, it's painful. I know you specialize in procedures that are fast and not painful. Can you talk to us about the advancements there?
I'd love to. So as a maxillofacial surgeon, as an oral surgeon, the majority of the things I deal with are things that no one wants to come to the office to have done. Right? Just like you said, everyone thinks it's painful, it's going to take a long time, but we've made so many advances, such as intravenous sedation. So almost all the procedures that I do in my office, the patient is sedated for or asleep. Older patients may be able to correlate that to having a colonoscopy, type of colonoscopy sleep, but it's basically twilight medication, intravenous medication that's injected into the patient. And while the patient is safely monitored, all the procedures are done with them asleep. So when they wake up, everything is complete. They have no recollection of what happened. And to them, to their mind, almost no time has passed. Dental implants, which is one of the mainstays of my practice, have become mainstream. So in years past, when someone was missing a tooth, they'd need to get a denture, or they'd need to get a bridge by anchoring it to other teeth. But with dental implants, which can replace your individual teeth or even all your teeth, that's a 5 to 10 minute procedure in the hands of a trained maxillofacial surgeon. Most of our procedures are done using what's called computer guidance, so that we have a lot of information before we even treat the patient. We gather information by taking certain scans of the patient's jaws and their mouth, and then we know exactly what we're going to do, so there's limit of surprises. We have a plan, and once the patient is sleepy, we can move along and get things done relatively quickly. And I've always felt that the less amount of time that we are in the patient's mouth doing surgery, the less discomfort there is afterwards, the less swelling, the less pain. So the idea is to really streamline, within very safe guidelines, the entire process of tooth replacement with dental implants. And almost all procedures can be done with intravenous sedation as long as the patient is healthy to undergo this type of a procedure.
Wow, yeah, it's amazing how you're mixing the technology with comfort and then results at the same time. So this is an age-old question. At least I'm saying it is. Water pick, yes or no? Manual versus electric? Waxed or unwaxed floss? There's a lot of debates and uncertainty. Can you please tell us your opinion on those three things?
I'd love to. So the easy answer is yes to all of those. So if you have to make a choice whether to use any of them or not use any of them, choose to use them. Basically getting back to oral health. So water pick is an aid to brushing. All of these things are not solo either or. Traditionally, the basic toothbrush is still the best method for oral health. Now, there have been mechanical advances such as electronic or electric toothbrushes or water picks. So if you're going to pick one that you're going to really relatively easily use. I feel that electric toothbrushes are really meant for those patients that have maybe some mechanical manual dexterity issues, patients that are older, patients after trauma, patients with, let's say, diseases like neurological diseases like Parkinson's may have issues with holding a toothbrush. The electric toothbrush makes it easy. If you're into gadgets, the electric toothbrush makes it easy. Water pick is kind of an aid to replace flossing, although some studies have shown that traditional flossing is still considered better. So pick either one of those, pick something, do something to improve your oral health. Waxed or unwaxed really is a matter of preference. There are advantages to either one. So we're talking about floss. Waxed floss is slightly easier to get in between your teeth because the wax aids in the gliding of the floss. And patients with very tight teeth contact are more likely to use waxed versus unwaxed. Unwaxed is thinner, so a little bit less traumatic. Some waxes come in flavored, some waxes come unflavored, totally your choice. The basic idea is use something every day to clean your teeth and your gums, and then you'll live longer and be in good health, and all is good.
Well, Dr. Stein, thank you for that. I'm a tech guy, so I'm going to stick to my electric toothbrush and my water pick. So I appreciate that. Thank you for being here today. Tell everyone how they can get in touch with you and how can they reach out if they need to also get implants, get their oral health where it needs to be.
Thank you so much for the opportunity. The best way to look me up is on the internet, www.nyoralsurge.com, or they can just look up Mark Stein, DDS MD. We're located in Midtown Manhattan on 5th Avenue across from Central Park, and our number is 212-888-4760. I look forward to helping people, and I appreciate the opportunity to chat with you today. Thank you.
Dr. Stein.
Thank you so much.